Ulnar neuropathy is a condition in which the ulnar nerve becomes irritated, compressed, or damaged. This nerve runs from the neck down the arm, passes behind the inner side of the elbow, the funny bone area, and continues into the hand. It helps control some hand muscles and gives feeling to the little finger and part of the ring finger. When this nerve is under pressure, it can cause numbness, tingling, pain, and weakness in the hand and forearm. The most common form is compression at the elbow, called cubital tunnel syndrome, though it can also happen at the wrist in Guyon's canal. Why it happens? Ulnar neuropathy usually happens because the nerve is repeatedly stretched or pressed. Common causes include frequent elbow bending, leaning on the elbow for long periods, sleeping with the elbow bent, repetitive work, cycling with pressure on the palm, or injuries such as an elbow fracture or dislocation. In some people, arthritis, bone spurs, cysts, swelling, scar tissue, or even poorly fitting casts can compress the nerve. Certain medical conditions, especially diabetes, may also make nerves more vulnerable to damage. Sometimes no clear cause is found. Main symptoms. The most typical symptoms are tingling and numbness in the little finger and ring finger, especially when the elbow is bent for a long time. Some people feel an electric or pins and needles sensation. Others notice pain at the inner elbow or wrist, depending on where the nerve is trapped. Symptoms often come and go at first, but may become more constant if the problem worsens. Night symptoms are common because many people sleep with their elbows bent. Weakness and hand problems. As the condition progresses, the nerve may stop working normally in the hand muscles. This can lead to weak grip, dropping objects, difficulty opening jars, typing, buttoning clothes, or writing. Fine finger movements may become clumsy. In more severe or long-standing cases, the small muscles of the hand can shrink, muscle wasting, and the ring/little fingers may begin to curl into a claw-like position. This is a sign that the nerve has been under pressure for too long and needs medical attention quickly. How doctors diagnose it? Diagnosis starts with a medical history and physical exam. A doctor may ask when symptoms happen, whether elbow bending makes them worse, and whether there has been trauma or repetitive strain. During the exam, they may check finger strength, sensation, and tenderness around the elbow or wrist. To confirm the diagnosis, doctors often use nerve conduction studies, NCS, and electromyography, EMG. These tests measure how well the nerve sends signals and whether muscles are being affected. In some cases, ultrasound, X-ray, or MRI may be used to look for cysts, arthritis, bone spurs, or other structural causes. Treatment without surgery. Many mild to moderate cases improve with conservative treatment. The first step is reducing the pressure on the nerve. That means avoiding leaning on the elbow, avoiding prolonged elbow bending, changing workstation posture, and taking breaks from repetitive tasks. A night splint or elbow brace may help keep the elbow straighter during sleep. Doctors may also recommend physiotherapy or occupational therapy, including nerve gliding exercises, posture correction, and hand strengthening. Pain and inflammation can sometimes be relieved with medicines such as NSAIDs if they are safe for the patient. Early treatment usually gives better results. When surgery is needed. Surgery may be advised if symptoms are severe, if there is clear weakness or muscle wasting, or if non-surgical treatment does not help. The goal of surgery is to release pressure on the ulnar nerve. Depending on the exact problem, a surgeon may free the nerve, remove a cyst or other blockage, or move the nerve to a less irritated position around the elbow. Recovery depends on how long the nerve was compressed before treatment. Mild cases often recover well, but severe long-term nerve damage may not return completely to normal. Complications and outlook. If ignored, ulnar neuropathy can cause lasting problems such as permanent numbness, weakness, poor hand coordination, muscle loss, and reduced ability to perform daily tasks. The good news is that many people improve, especially when the condition is recognized early and pressure on the nerve is removed. Prevention is also important. Avoid resting on hard elbows, use proper ergonomics, stretch during work, and seek care if tingling or weakness persists. Anyone with progressive weakness, hand muscle wasting, or constant numbness should see a doctor promptly.